Good morning, everyone. Myself, Dr. Maheshwari. I'm from Arvind Eye Hospital, Coimbatore. I'll be talking on Trash to Treasure RETCAM, Treasure to Save Sight Amidst Pandemic. Diabetes is a global epidemic, and India is a diabetes capital of the world. Diabetes mellitus prevalence is projected to grow to 101 million by 2030 and 134 million by 2045. Proliferative diabetic retinopathy and diabetic macular edema are two main sight-threatening components of diabetic retinopathy. WHO screening criteria includes diseases that are an important health problem, have effective treatment which is possible to be delivered early, technology for diagnosis is available, screening is feasible and cost effective, and subjects can be followed longitudinally. So the criteria for DR includes type 1 DM patients within 5 years of diagnosis, type 2 DM who has to have first retinal examination at the time of diagnosis, women with GDM and are not a known diabetic with random blood sugar more than 200 milligram or HbA1c of more than 6.5. The models for DR screening available include hospital-based study, community-based study, and teleophthalmology. In pandemic, teleophthalmology played a very important role in screening of DR patients by bridging the gap of distance, time, and burden on manpower. The available devices for screening of DR can be divided into tabletop, handheld, and smartphone-based devices. The aim was to evaluate diabetic retinopathy screening using Trash to Treasure RETCAM at vision centers in rural and underserved areas of Tamil Nadu for teleophthalmology during pandemic. It was a prospective hospital-based studies conducted at 11 vision centers over the time span of 6 months. Over a period of 6 months, 11 vision centers, 1,904 patients were screened, out of which 851 patients were diabetics and 72 patients were diabetic retinopathy. 49 of 72 patients who had vision-threatening diabetic retinopathy were referred to tertiary eye hospital for further examination and management. The mean age of this group was around 54 years. Out of 49 referred patients, 35 patients visited retina clinic and 14 were lost to follow-up. 56 eyes of 35 patients were diagnosed to have vision-threatening diabetic retinopathy and was referred in need of treatment to tertiary eye hospital. So these are some of the images taken using this device. The treatment included PRP, intravitreal anti-VEGF, and vitreoretinal surgery. At the height of the pandemic, elective services like community-based screening for diabetic retinopathy was halted universally to prevent community spread of COVID. Teleophthalmology played a very important role in these difficult times to continue diabetic retinopathy screening. Smartphone-based T3R is a do-it-yourself frugal fundus imaging device. There are various other devices for the same. The international acceptance and concurrence that the screening test for DR should have at least of 80% sensitivity, 95% specificity, and less than 5% technical failure rates. So, this device is known to have a sensitivity of 88.4% and specificity of 100%. These are some of the images other than diabetic retinopathy which was taken using this device. It can also be used to explain the patient regarding the disease and the treatment we are doing. It can nowadays we are also using it to screen ROP. Like when we fellows go for screening purpose and we need expert opinion from our consultants, we take images with this, send it to our consultants, and if needed, we refer the baby to the brace center because all these babies are sick babies in NICU and need extra care even if we want to shift. So unnecessary referrals can be avoided using this device. So this is how we use Trash to Treasure RETCAM in ROP screening, where we sent our images to the consultants, and only if needed, the babies were sent to the base hospital. Even AROP babies, which could be observed, were observed, and only when need were referred because all of them were high-risk babies. And this, some of the images show how we have explained the images to the patients to make them aware of the condition. To conclude, with the epidemic of diabetes mellitus related visual impairment and blindness looming on us, it is imperative that we take all measures to reduce the burden of sight-threatening diabetic retinopathy. It is the time that DR screening evolve into ophthalmologist supported rather than to continue to be an ophthalmologist-led screening program. T3R smartphone-based telescreening device with very minimal investment which can be used in peripheral centers associated with multi-speciality eye hospital for screening. Thank you.